Greetings! My name is Lea Kilenga, coming to you from Kenya, a place called Taveta, a very rural place in Kenya, and I live with sickle cell. What will I define sickle cell as? Sickle cell is pain. Physical, emotional, psychological, different levels of pain that affect not only the individual but the household and the community if not managed or taken with the seriousness that it deserves. I will quantify sickle cell pain as this devastating tooth pain that keeps you up at night. You cannot sleep, you cannot do anything without resolving that issue on your tooth. So imagine that and magnify that a thousandfold, depending on your pain threshold, to the long bones of your body. And this is acute and it's chronic and it's a very difficult disease. So that is sickle cell. In our household, we were 3 out of 4 children living with sickle cell. So you can imagine the amount of pain, not only physical, but the psychological and the emotional distress that was experienced in our household. Unfortunately, we lost our older sister from malaria, which is one of the leading causes of sickle cell mortality in children, in young children. I didn't know that I have the high possibility of also dying because of sickle cell. Until I reached 13, when I realized I was different. My eyes, my jaundiced eyes, my distended stomach, my skinny body wasn't as similar as everyone else. And I realized that at that point, I came to realize that it is not normal for all children to take medication every day. It is not normal to wake up in the middle of the night with a chronic and severe debilitating pain that you need to be rushed to the emergency room. It is not normal for you to all the time get relatives donating blood because you need to get blood transfusions. And I am still understanding what sickle cell is. I am still accepting because sickle cell affects all levels of your life. The community see you, especially in rural communities where they don't understand sickle cell. For example, here in Taveta, and they say sickle cell is witchcraft or is satanism, and which child goes to the hospital getting blood every day? What is that thing that needs blood? We have 47 counties in Kenya. 25 of those counties have a sickle cell burden of public health proportions. And I have to say that a handful of those counties actually recognize sickle cell, actually have facilities that are equipped to respond to sickle cell and have the capacity with regards to healthcare workers who can respond to sickle cell. For example, we have 2 clinics in this county in Kenya, in Taita Taveta County. One that was launched with Novo Nordisk Hemophilia Foundation and Kenya Hemophilia Association. We are seeing a degree of difference with regards to the service available in the clinic that was launched and the ones that we have, and the current clinic that we have in Taveta. The services we have medicines, we have healthcare workers that have been trained, we have a facility to see these patients. But in Taveta, we do not have medicines, we do not have commodities, and we do not have trained healthcare workers, nor do we have the room to see these patients. Through facilities, through centers of excellence, and through, for example, the hemophilia sickle cell clinic, we can be able to get quantitative and qualitative data. So this is evidence that we can use to be able to eloquently speak towards sickle cell and hemophilia and to be able to get governments to respond to this issue.